What's up, beautiful people? Another day, another study. We've talked a lot about alcohol on the channel. I firmly believe America has a alcohol consumption problem and that alcohol can have widely varying negative health effects. And recent evidence shows that there is no benefit to any level of alcohol consumption for brain health or cardiovascular health. Now, this study was interesting because it looked at a dose response for alcohol cessation and improvement in blood pressure. Hypertension affects half of adults here in the US. And one of the strategies I use in my practice all the time is to try to reduce people's alcohol consumption. So they use 10 grams of alcohol as the reference value for one drink. That's another big problem. People think they're only having one drink and it's like half a bottle of wine, or they're putting a mixed drink with like 2 or 3 shots, and they're calling that one drink. So a reduction of 10 grams of alcohol consumption was associated with systolic blood pressure reduction of around 1 and a diastolic blood pressure reduction of 0.8. And there was a dose response. So the more drinks you stop drinking, the better the blood pressure reductions. When people reduce their consumption by 4 drinks or more per day, they reduce systolic blood pressure by 5.6. And these reductions were similar for diastolic blood pressure, and the results are similar when they looked at both men and women. And then in the initiation cohort, those who weren't drinkers before, who initiated drinking, you saw pretty much the same thing. For every 10-gram increase in alcohol consumption, systolic blood pressure increased by 0.78 and diastolic blood pressure increased by 0.53. So for someone who wasn't drinking and then started drinking 4 or more drinks per day, there was an increase in systolic blood pressure by 4.35. Now, these results were similar across multiple different beverage types. There's still a myth going around out there that wine or certain types of alcohol may be more beneficial than others because of polyphenol contents and so forth. But this showed that it didn't matter what type of alcohol they stopped, the results were similar. Also, the effects were stronger in people who had pre-existing hypertension than people who didn't. So people whose blood pressure was higher at baseline saw better effects with alcohol cessation. It's why I highly recommend it, evaluate it in patients who have hypertension. Now, while these numbers may seem small, we know that from previous meta-analyses, even a 2 millimeter of mercury reduction in systolic blood pressure lowers the risk of stroke mortality by 10% in ischemic heart disease. So that's when the heart clogs, the arteries clog, by 7%. So at the population level, that makes an extraordinary difference, even by small reductions in blood pressure.